So many of you might have heard, Bupa Dental Care has made the decision to sell, to close, or to merge 85 of its dental practices across the country. Now, Bupa is a dental corporate and they've been struggling to continue to keep their dental practices, 85 of them, open. Costs are high, and they're unable to make the businesses, break even. The businesses are losing money. They're struggling to recruit dentists across the country, and they're struggling with the increased inflation, which means that costs are higher for materials and bills are higher to sustain the dental practices. Bupa owns 475 practices across the country, and if they're making this decision with 85 of their practices, which provide NHS dental care, then it's a question that needs to be asked. Is it still possible for dental practices to be fully NHS and survive? If a corporate like Bupa is being affected like this, what pressure do dental practice owners who own a single practice or two practices, what pressure are they facing? Because they haven't got the same financial backing as someone like Bupa. And these dental practices that are owned by one or two individuals, they need to be profitable in order to pay staff, in order to pay the bills, and in order to continue providing a service. And this is a sign that provision of dental care services under the NHS just isn't working. It's been known for a long time, for years, but this is one of the significant signs, Bupa closing down some of his practices, that we're getting to a point where things are going to drastically change when it comes to dental care provision in the UK. Costs are increasing due to inflation. So the costs for materials have gone up, and the costs, for bills have gone up. So running a dental practice is much more expensive than it used to be. And in the NHS model, because the amount that dentists or dental practices get hasn't really changed at all over the years, it means that costs have gone up, but the income hasn't gone up when you look at solely NHS dental practices. And we're seeing how this is now impacting even the big corporates like Bupa, who are trying to provide NHS dentistry to a lot of people across the country. They're finding it extremely difficult. So you can only imagine how much more difficult it would be for the dental practices that are owned by an individual, where if they're trying to just provide dental care purely through the NHS, it's just not adding up anymore for most people, and they're ending up having to shift towards a private model in providing dentistry. What's actually been happening over the years is that dental practices who provide NHS dental care as well as private dental care, it's actually the private side that's been sustaining the practices to be able to continue running, and the NHS side of dental care provision has actually been working at a loss for many practices. So it's actually been the private side that's actually been allowing for the NHS to be propped up in terms of dental care. And this is getting harder and harder year by year for practices to do. So from what we can see with the example of Bupa, it's likely that in the future, more and more dental practices are going to be giving up their NHS contract, and more practices are going to have to be relying on providing private dental care to be sustainable and to continue to be able to pay their staff, pay the bills, and be able to make some sort of profit from running a dental practice. So what does this mean for patients? Well, with how things currently are, if you're looking to try and get an NHS dentist, it's probably going to be near enough impossible for you to find an NHS dentist who'll be able to take you on, because NHS dentistry is at capacity. Because NHS dental care is at capacity, it means that you're going to have to be looking at private dental care in order to be seen in a timely fashion. Trying to wait on waiting lists for the NHS, it's highly unlikely that you'll ever get a place using that route. So it looks like more patients are going to be having to look at dental practices who offer private dental care. In terms of staff, dentists, nurses, therapists, hygienists, it does look like clinical staff are now choosing to move towards providing dentistry privately because trying to work under the pressures of the NHS just isn't a viable option for many now. And you'll hear and you'll see news articles that will talk about the numbers of dental care professionals who are moving towards private dental care. I recently made the decision to move into a fully private practice, and I've seen the difference in terms of the satisfaction I get from the job, being able to provide better quality care to my patients, having longer appointments with my patients, being able to go through their dental condition and state in a lot more detail and help them to really turn around their dental health. I found that I've had more time to be able to do this. I've had the equipment, materials, facilities to be able to provide that high quality care. And if anyone is ever to ask me, would I ever go back to providing dental care under the NHS? It's highly unlikely that I would ever go back to working under that sort of pressure and under that sort of environment. For some clinicians, they're able to make it work for them working under the NHS, but I know for myself, it's just not an environment that I want to be working under. The way I see dentistry going in England is that for provision of emergency dentistry, so people that are in pain, maybe a tooth needs taken out, that's probably what NHS dentistry is going to involve and be a core service. And if you want routine dental care, if you want really to get the best out there for your dental care, it looks like that'll probably be offered on a private basis with how things are going. It looks like the NHS will mainly be for emergency dental care provision. And sadly, that's just the way it looks like it's going.